In exploring father figures, the role of therapy in healing from paternal abuse, it is crucial to first understand what paternal abuse entails and its profound impact. Paternal abuse refers to any form of abusive behavior, be it physical, emotional, verbal, or psychological, inflicted by a father or father figure. This abuse can leave deep scars, shaping an individual's emotional and psychological development, often carrying repercussions well into adulthood. The significance of understanding paternal abuse lies in its pervasive and often insidious nature. Recognizing the impact of such abuse is essential in addressing its consequences, which can manifest as low self-esteem, trust issues, anxiety, and relationship problems. By acknowledging and understanding these effects, individuals can begin the therapeutic process of healing and reclaiming control over their lives. Two specific examples illustrate the impact of paternal abuse. Take the case of a successful professional who struggles with anxiety and perfectionism stemming from a childhood where nothing they did was ever good enough for their father. Such a background can lead to chronic stress as the individual strives for unattainable standards set by those early experiences. Another example is of an individual with a fear of intimacy, stemming from a father's verbal abuse that consistently belittled their worth. Therapy can be instrumental in such cases, offering individuals the tools to understand their past and develop healthier coping mechanisms. Experts in psychology and psychotherapy often emphasize the critical role therapy plays in addressing and healing from paternal abuse. Therapy provides a safe environment to process these past traumas, recognize harmful patterns, and foster resilience. However, the topic is not without controversy. Some argue that focusing on paternal abuse can disproportionately overshadow other familial influences, such as maternal abuse or sibling dynamics, which can also significantly affect an individual. Others might contend that therapy, while beneficial for many, isn't a one-size-fits-all solution and should be augmented by additional resources and support systems. Despite these opposing viewpoints, understanding paternal abuse connects deeply to the broader theme of the protective role support systems play in healing. By comprehensively addressing and working through issues stemming from paternal abuse in therapy, individuals often find themselves better equipped to establish healthier relationships, enhance their self-esteem, and ultimately break the cycle of abuse. This understanding emphasizes the overarching theme of empowerment and recovery, marking a significant step toward healing and personal growth. Defining father figures involves understanding the various archetypes and influences these figures have on individuals' lives. Father figures are not limited to biological fathers. They can be anyone who takes on a paternal role, such as stepfathers, uncles, teachers, or mentors. Archetypes like the protector, disciplinary, and provider embody their traditional roles, shaping expectations and behaviors. These archetypes and influences profoundly affect a person's development, especially when the relationship includes abuse. The significance of understanding father figures in the context of paternal abuse and healing through therapy lies in recognizing how these paternal archetypes contribute to an individual's narrative and self-identity. Therapy can help unravel these complex layers, offering a route to healing by redefining one's understanding of these figures. Acknowledging both the positive and negative traits of father figures is crucial for confronting and reconciling feelings of anger, betrayal, or loss, which often accompany experiences of paternal abuse. Consider the example of a young man whose stepfather was his primary father figure. If this man experienced emotional neglect or authoritarian parenting, these experiences shape his adult relationships and self-esteem. Therapy may help him reconcile these feelings by identifying and challenging internalized negative archetypes. Alternatively, consider the influence of a coach regarded as a father figure to an athlete. If this relationship was supportive, it might balance negative paternal experiences, showcasing the diversity of these influences. Psychoanalysts and therapists emphasize the importance of exploring paternal influences in therapy. Carl Jung's theory of archetypes and the collective unconscious suggests that these fatherly archetypes are deep-seated and universally impactful, supporting the idea that addressing them is critical to personal healing. However, challenges to this approach may include cultural variations in the perception of paternal roles or varying definitions of what constitutes a father figure across different societies. Some argue that focusing too heavily on paternal archetypes might overlook personal experiences or matriarchal influences. Understanding father figures and their archetypes is integral to therapy, as it informs treatment strategies for healing from paternal abuse. These insights connect to broader aspects of the therapeutic process, such as developing a healthier self-image and improving relational dynamics. Exploring these influences allows individuals to deconstruct harmful patterns imposed by past paternal figures and rebuild a balanced sense of self, ultimately aiding in recovery and personal growth. The psychological effects of paternal abuse can be profound and long-lasting, shaping an individual's emotional and mental well-being. Paternal abuse, whether it is emotional, verbal, physical, or neglectful, can lead to complex psychological issues such as low self-esteem, anxiety, depression, post-traumatic stress disorder, PTSD, and difficulties in forming healthy relationships. The pervasive impact of such abuse often extends into adulthood, affecting one's ability to trust, regulate emotions, and establish a positive sense of self. Understanding the psychological effects of paternal abuse is crucial because it highlights the deep-rooted challenges individuals face when seeking to heal and improve their mental health. For instance, a person who has endured verbal abuse from a controlling father may struggle with pervasive feelings of inadequacy and heightened sensitivity to criticism. This can hinder academic or career achievements and prevent forming supportive personal relationships. Another example could be an individual who experienced neglect, resulting in an intense fear of abandonment and difficulty relying on others. These experiences underscore the importance of addressing paternal abuse in therapy to enable healing and recovery. Many mental health professionals emphasize the transformative role of therapy in confronting these psychological effects. Therapists often employ trauma-informed approaches, such as cognitive behavioral therapy, CBT, or eye movement desensitization and reprocessing, EMDR, to help individuals process and reframe negative experiences, thereby fostering resilience and improving mental health outcomes. Experts in the field argue that therapy can provide a safe space for individuals to voice their experiences, receive validation, and develop coping mechanisms. However, addressing paternal abuse and its psychological ramifications can be complex. Some individuals may face challenges acknowledging the abuse due to societal norms that idolize fathers, leading to denial or minimization of their experiences. Additionally, there can be familial pressure to maintain loyalty or protect family reputation, which complicates the healing process. Others might encounter skepticism or misunderstanding regarding the validity of their experiences, which can further alienate them from seeking help. Despite these challenges, recognizing and addressing the psychological effects of paternal abuse is integral to the broader topic of using therapy as a means of healing. By understanding these impacts, individuals are better equipped to navigate their path to recovery, rebuild their sense of self-worth, and foster healthier relationships in other facets of their lives. In this way, therapy serves as a vital tool for transforming the consequences of paternal abuse into opportunities for growth and empowerment. The therapeutic process is a guided journey through which individuals address and work through trauma, often facilitated by mental health professionals. When dealing with paternal abuse, this process can be pivotal in healing, as it provides a structured environment for individuals to confront and process emotional wounds. Therapy types such as cognitive behavioral therapy, CBT, and psychodynamic therapy are commonly employed. CBT focuses on identifying and changing negative thought patterns and behaviors that stem from the abuse, while psychodynamic therapy delves into the subconscious to unearth and address deeper emotional issues related to one's relationship with their father figure. The significance of therapy in this context cannot be understated. Paternal abuse can leave profound and lasting scars, not only affecting an individual's self-esteem and relationships, but also perpetuating patterns of abuse or dysfunction into future generations. Therapy serves as a critical intervention, helping individuals not only to heal, but to break these cycles, thereby paving the way for healthier relationships and emotional well-being. For instance, an individual who experienced verbal and emotional abuse from their father might turn to CBT to learn new coping mechanisms and cognitive restructuring techniques. This therapy could help them stop internalizing negative messages received during childhood and reshape their self-image positively. Conversely, someone else might engage in psychodynamic therapy to explore how their father's behavior affected their current relationships. By understanding these deep-rooted influences, they can begin to develop healthier patterns of interaction. Supporting opinions highlight that therapy provides a safe space for validation and empowerment, crucial elements for someone recovering from such an intimate betrayal. Advocates argue that it allows individuals to process their emotions at their own pace, with professional guidance that ensures they are not re-traumatized during the exploration process. However, not all viewpoints are unanimous. Some critics question the effectiveness of therapy, suggesting that not every individual can benefit equally from talking about their past, especially when it comes to severe trauma. Others raise concerns about access to therapy, noting that cultural stigma, financial constraints, and availability can hinder people from seeking the help they need. This point intimately ties into the overarching theme of paternal figures because it underscores the potential for transformation from a place of deep pain. By engaging with therapy, individuals reframe their narratives, potentially shifting the impact of paternal abuse from a defining negative to a source of resilience and healing. Thus, the therapeutic process is not merely about healing past wounds, but also about empowering individuals to redefine their future, free from the shackles of an abusive, paternal influence.